Welcome, everyone. And today in this session, we will be delving into the architectural and functional design of modern imaging rooms, spaces that are critical for diagnostics, workflow efficiency, and patient safety. When we're going to focus on two things mainly, we're going to explore the structural components that ensure compliance with radiological standards and optimize room performance, and highlight the key design elements that enhance clinical workflow, patient experience, and staff workflow. So I would like to take a moment to actually introduce our company. I guess maybe not everybody is yet working with us. So Signify is the industry leader, the lighting leader in the world. So we are active in 74 countries. You can find pretty much any solution in our portfolio, starting from light sources, luminaires, but also systems and services. And if we talk about our investments, we actually have our own established R&D team. So maybe Ramon, the next slide, we can show that we actually do invest for already so many years into our own R&D and research. We also see a significant, development in our portfolio, which is dedicated to circular solutions, which are specifically interesting for healthcare environments, because of course we all recognize that the impact of the healthcare as an industry is huge in terms of sustainability. And I just wanted to highlight that we have a very special program that targets to improve lives of underserved communities. Together with Signify Foundation, we are investing and donating our solutions towards underserved communities, be it in education, like schools, or actually healthcare facilities. And I wanted to just highlight a recent project where we supported midwives in Africa just by providing light. These professionals could help women deliver babies safer. Because imagine, I mean, you think light is not a significant thing, but it's just because it's there, right? If there is no light and a woman has to deliver a baby during the night, then it's a fireplace that they had to use, which is, of course, has its own implications for the baby delivery. So we were very happy that we could support this community, and we are looking forward to work with more communities. So if you have such a project in mind and you would like to work with us on, potentially supporting such communities, we are happy to consider. And I just wanted to highlight that we are open for a collaboration on research and innovation. We are working with hospitals, with doctors on various topics. Also specific applications, for example, delirium in ICU, or patient anxiety, mental care. So if you have a research interest and you would like to have an engagement on a specific project, please feel free to let us know. We would be happy to engage. So talking about what Signify can do for a healthcare facility, and of course, not only hospitals, but especially hospitals, we do work as professionals for medical spaces. So patient room, operating theater, imaging room, of course, Signify does have a solution, but we also provide the end-to-end services. And if you would need to, for example, work on the total campus, including the road and street, the facade, the park solutions, this is also possible to have Signify as a single supplier from that perspective. And I would like to introduce our key speakers today. So starting with myself, I'm a global healthcare practice lead for Signify, actually working with the total portfolio and the total value proposition for healthcare practice. We have today with us Ramon van de Ven, our senior designer, Bart van Gils, our application specialist, both focusing on healthcare application, and Jelle Zegers, our business leader for Nature Connect portfolio. And now we are also curious to hear, why did you guys come here today? what would you like specifically to learn about during this webinar? We want to ensure that our story is tailored to your interests, and I would kindly ask you to take a time to actually answer a small question. What are your expectations from the webinar? What would you like to learn today? And if you see in the right side, in the corner, you can actually choose whether it's a best practice that you're looking for, or you're specifically interested in energy saving solutions, or maybe specific innovation and technology that you would like to be learning about today. Please do let us know. Take your time to submit your answer. It really helps us to tailor the story today. I give you a few moments for consideration. And normally we should be able to see the response. And actually we see that pretty much everybody would like to learn more about all best practices, but actually all the technology trends in the energy saving would also be relevant. This is great to actually see. Hopefully our story will be relevant to most of you today. And if you have any specific questions, please make sure that you post your question in chat box, and we will take care of that either during the session or we'll follow up with you afterwards. Yes. So imaging suites. Here in the picture, you actually see um, uh, basically MRI suites and imaging suites from all over the globe, right? So you see US, you see India, Ireland, and from all these pictures, what is common is, of course, that huge machine that is in the center. So we were thinking to actually give this webinar also with a reason. Whenever a hospital is being developed, this is one of the first places that normally designers, architects, engineers are taking into account because of the size of this machine, because of the complexity and the safety requirements that we need to comply to. So what you see here, it can be a very functional space focused on delivering the service. But if you see to the right corner, below, you actually see that it can be a very enhanced experience, really patient-centric. And this is especially critical, for example, if you think of the kids, right? So for a child, it's very hard to stay quiet, silent, and don't move for a long time, right? So apparently, more and more designers, architects do recognize the necessity to support the patient experience. And this is the key trend that we wanted to highlight today. But also, enhancing the staff health and well-being is another big topic. Well, there is a pressure on workers, and they have to really work quite often in in very difficult environments, long shifts. These rooms are quite often booked months in advance, and yeah, personnel doesn't have time to actually go outside, relax a little bit. It's really tough environment to work in. So I would like to take a moment to actually analyze the space that we are talking about, because of course we are going to talk about the lighting design and the controls related to that. But to do that very effectively, we need to understand also what kind of space we're dealing with. I am not going to talk about the machine itself, but I just wanted to highlight that today we are specifically focusing on the MRI suites, CT and PET scanner, but not maybe X-ray, which quite often even can be mobile. So more the larger machines. So you see 3 rooms highlighted here in the picture. It can be, of course, different. So let's start reviewing each room separately. So number 1 is the scanner room. This is basically where the patient undergoes the actual procedure. Quite often, this is also the room where the patient is being prepared for the procedure by the medical staff, being instructed. And actually, this is where it is very important to ensure that patient is feeling comforted uh, and relaxed, and actually is following the guidance of the staff very carefully. In the room number 2, highlighted here in the picture, we actually talk about the control room. This is where the basically personnel is located while the scanner is in operation. And quite often, this room, if we are talking about MRI scanner, is separated by a glass that basically the doctor can see the patient, so that it's also visually controlled, I mean, during the procedure. But this glass is shielded from the in terms of like to protect from the magnetic field. In case of CT and PET scanners, this is also a shielded glass, but it's more a protection from the radiation. So as you can see, safety is quite important here. Things like EMI and cleaning compliance are another topics that we would like to consider here while we are designing the spaces. And in the picture, we also have the room number 3, but this is, let's say, not always the case that a scanner room may have this as a separate setting. This is basically related to the waiting area where the patients wait either between the procedures, or imagine if we're talking about a PET scan procedure. This is where patients actually have to take the radioactive tracer injection, and then they have to wait up to even 90 minutes sometimes to get the the tracer absorbed, and then only the procedure starts. And of course, the patient is in maybe in a different condition, so there must be also an observation at all the times, right, before and after the procedure. So with that, maybe I would like to move to the actual core content today. So Ramon, please.
Yes, thank you, Elina. So this presentation is part of our application guides, and these guides contain use cases, concepts and solutions for one specific application in the hospital. And in the next slides, we will present the application guide for imaging suites. And if you want to know more about our other hospital applications, you can reach out to us or to your local Signify contact. So the structure of these application guides is always the same. So first we explain the use cases, and we explain the context of the application, and we describe the needs for each user and the benefits of our offer. And in the second part, we explain the solutions. So we describe the concepts that are based on these use cases, and then we show examples of how to apply our products and systems to come to solutions that best fits these use cases. So yeah, the main users of imaging suites, these are the medical professionals working there. So they are responsible for preparing the patient and ensuring their comfort and their safety. They are operating the equipment, and also they controlling the quality of the results. So the first step of controlling that. And then patients, for patients undergoing a procedure like this, like scanning, can be very stressful. The environment is intimidating with all the devices, and there's a lot of noises, strange noises, and often there's waiting involved in between procedures. And it's also can be really anxious. They can be anxious because of they are afraid of the outcome. So what's the challenge in designing an imaging suite is to provide a comfortable and calming environment for patients, so we can minimize stress and anxiety, while supporting medical staff in operating the equipment and communicating with patients. So I just want to go to a typical patient journey. So Elina already explained the different areas that we focus on. And this is how they go through that. So first of all, it's always a check-in, and that's maybe an entry desk. So they check personal information and medical information. Then normally they wait for the next step in the process. That's then the briefing. So this is where the patient gets explained what the procedure is. And also sometimes they measure height and weight for PET scan for the radioactive tracer to dose it right. checking for metal objects, these kind of things. There's probably another waiting step, and yeah, like I said, for PET scan, they get this radioactive tracer injected, and this takes some time for the body to be absorbed. That can take up to 90 minutes, and it's mostly in a closed environment because it's radioactive. Then preparing for the scan. So here medical staff helps the patients to be positioned right on the table. Sometimes they get an IV line in place if a contrast fluid is needed. And also some last instruction and also reassurance of the patient. And then scanning. So that can take up to from a few minutes for CT scan up to 45 minutes or even more for MRI. And here, like Elina said, the medical staff is normally in the control room, protected. They communicate via the intercom. And yeah, sometimes, in some cases, they maybe can play music or even a film to help patients relax and also to kill the time. And then after that, that's mostly a briefing, so a debriefing. So what instruction on what people shouldn't do and should not do in the next hours. And if contrast fluid was applied, then normally they have patients wait for another 10 minutes before they really leave. So to summarize the needs of the main users, the patients need a calming environment to feel at ease and to reduce stress. And staff needs optimal supports to do that task properly, but also to protect their well-being. And there's 5 categories we will look at to do this. So the first one is relieve patient stress and anxiety during scanning, but also during waiting times by creating this calming ambience. Support well-being, and then we look at staff especially because keep them healthy and support a healthy biorhythm because they're inside all day. Also support staff to do their task properly, to support all the routines and protect their safety. And also provide intuitive controls. And we will go, in the next slides, we will go a bit more in depth in these 4 categories. Just to remind you, if you have any questions about any of these subjects, please put them post them in the chat and we will answer them. So starting with the first one, relieve stress and anxiety. So we know patient comfort is key, because they must remain still during the scan to guarantee qualitative output, and also to avoid needing to repeat scans. This can be stressful for patients, but it's also very inconvenient and costly for hospital because it disturbs the planning. So how can we help patients feel comfortable and release stress? So first of all, we can use dimmable and tunable lighting to create a calming ambience. We can also add color and dynamic lighting to that to have even more flexibility in creating an ambience. And lastly, we can incorporate natural patterns and imagery. And this is creating positive distractions to help patients wind down. And this is a trend, Elina already said, and we also will show some examples of this later in the presentation. But now I want to ask Bart if he can explain a bit more about the products we use for this.
Yes, thank you, Ramon. This is the nice part. I can show the products that we are using in such an area. You see on the bottom right 3 examples of luminaires that we can place. And let me highlight one. The luminous textiles is on the left. This is a panel that you can use for dynamic content. So you can add color, you can add a dynamic artwork in the room to have a little bit of distraction during the waiting times to relax and make the patient at ease. The other product that you're seeing in the middle, that's cove lighting. We'll tell that later on. And then the last one is a downlighter. Can be special designed for image rooms. And of course, dimmable, meeting all the requirements in the area.
Thank you. So Our next category is support well-being. So we know lighting plays a key role in keeping our circadian rhythm stable, our biological rhythm. So, but we know imaging suites are typically inside the building, and they normally don't have access to natural daylight. And this can really negatively affect the alertness and overall well-being of the medical staff working there. So we can support well-being of medical staff by creating a connection with outside, by providing a substitute for daylight, and with lighting that supports the biological rhythm. And now Jella will explain a bit about how this would work.
Thank you, Ramon, and good day. Hello to everybody. I'm the manager of Nature Connect, and I'll explain throughout this whole session about the value of Nature Connect for, especially for the windowless and dark areas. So this picture on the left side shows a typical situation within a hospital, right? Where there's no daylight because of the whole structure of the building. On the bottom you see basically Nature Connect mini island, and what we create there is a skylight effect. So in the middle you see this blue sky. So it really has the idea that you look outside and the sun is shining, and we combine the blue sky, which gives the blue light, with white light, so that you really get a daylight feeling under it. So which gives a perfect situation to work under it. That gives a daylight feeling. In the middle you see basically the Nature Connect lightscape, and I'll show you some images a bit later that you can create a landscape situation on the wall, which is also dynamic over the day, so that you really have that feeling with what is the time of the day. Is it midday or is it end of the day? And on the right side you see the scenes which we create. If you go to the next slide, we did all kind of studies of Nature Connect to see what is the impact on people. And one of the studies which we did is to see how would people feel if they work on a Nature Connect. And basically what we did is we invited 30 people who had to work one day under normal lighting and the other day under Nature Connect. And basically what we could see, because everybody had to fill in questionnaires, is that people who worked under Nature Connect felt instantly more alert, and people above 41 felt much more vital when they work under Nature Connect. With the QR code, if you would scan it now, you would directly go into the study, so you can read all the details with what is behind this.
Okay, and you can of course always ask her for a link if you missed the QR code. The next category was supporting tasks and routines. So we know hospital staff often work under demanding circumstances, and then if the conditions are also not optimal, that can really cause fatigue. This can lead to errors, and this can lead to unsafe situations. So we really want to help staff to stay alert and reduce this risk of errors. We can do that with, first of all, high quality lighting, and then we mean low glare and accurate color rendering. So to provide the best vision, and also that because that is less tiring on the eyes. In the control room, we can use lighting that's optimized for screen work, because they are sitting behind a screen for longer times. So we need to make that as comfortable as possible, also to prevent fatigue on the eyes. And we can also play with indirect lighting, for instance, behind the monitors. So they can adjust this to individual preferences, and that also adds to their comfort. And lastly, and this is what Bart will tell, all these lighting solutions a few of these lighting solutions we can also use prepared for MRI, and that's what Bart now will explain to you.
Yeah, and this looks actually quite easy. Yeah, it looks like just a panel or a downlight or a cove lighting, but you have to, especially for MRI, you have to have really special products. If you see the next slide, this is what we add on top of the normal product. So EMI, electromagnetic interference, you should have none. Metal parts, none. So it's non-Faraday, EMI proof, and still dimmable and a good UGR. So this we can use for general lighting and have no interference with the scanner.
Thank you. And then the next slide, Elina.
So, yeah,
tell about.
thank you. Thanks, Ramon. And I think we even have a good question from Rashid today. He was asking, how can we dim the light? So actually, we indeed can do it in various ways, but today with the connected lighting, that can be quite an effortless way to control the scenes. And I think from Paul we also see that the hallway and the dressing room can also have an effect on the patient. So indeed, hopefully later today we will be able to show how we can design the whole area, but indeed you also need to take into account actually the whole facility and the environment, right? But with basically connected lighting, you can actually link the areas between each other, right? And organize the right presets to support the workflows. And we are also trying to use the intuitive interfaces, like here you see in the picture an Entumbra, which could be actually programmed specifically with presets. And these presets could be defined for your facility. So it doesn't have to be, let's say, something off the shelf. We can define a scene which you can call out, for example, scanning, and then a doctor just presses the scanning button, and then the light goes down for the patient. Maybe the RGB scenes are triggered, or the extra things are triggered, like even managing temperature, because the patient has to undress and sometimes even use the hospital clothing. So it could be maybe cold or too hot, for example. So you can really organize all these presets. You can control lighting, and with the dashboard, you can actually see not only the energy consumption, but also important statuses that are relevant for the personnel. Things like, is the scanner room occupied? Was it cleaned, for example? So all of that is available in the single UI, and can be used both by facility management and medical professionals.
Okay, so maybe before we get to the next part, are there any questions we need to answer, Elina?
I think I just tried to answer the comment on
Yeah,
consideration
that's
of
one.
adjacent areas and the dimming.
Good.
But if there are more questions, please continue posting those.
Okay, let me go to our next section. So we just discussed the use cases, the needs of our main users, and now we're gonna see how we can build solutions for that. So yeah, we take the use cases as a basis, and then we build three concepts on this. The first one is about quality and control. So this is a more basic setting, but it's still qualitative lighting and an easy control situation, so you can still dim or maybe even change the white point. And then soothing ambience. This is really built around comforting the patient. And then Nature Connect. This is really aims at staff well-being, because they are inside all day. So now we're gonna go a bit deeper in these three concepts. So the first one is quality and control. And so medical staff working in imaging suites, it's important that they have the best conditions to do their tasks, to stay alert, to not make mistakes, and to have effective communication with patients. So how do we do that? Yeah, by good quality lighting. We said it before, dimmable white lighting with good color, high color rendering that helps staff to perform tasks and that prevent eye fatigue. Easy control and automation, the story that Elina just said. They can change the room, the light situation in the room, with just one press of the button, depending on the task. And then the special MRI products that Bart told us about, which is really MRI proof, but with the same quality, same high quality lighting. And now Bart will explain a bit more how we execute this, possibly.
Yes, thank you, Ramon. Here you see a drawing, top view of the two areas. The other concepts, we also take the other areas in account, but this is just the first design concept. So it's mainly focusing on general lighting. In this case, you see the round downlighter using the general lighting, and the dotted line is a cove lighting we place on top of that, because you can easily dim that to a really low amount of light, and the operator can still have a good look through the window to the MRI and to the patient room. So the luminaires that we use in the first concept is a round shaped downlighter or a panel, as in this drawing, and it's a 60 by 60 panel for the general lighting. In both cases, we can provide the light for every image room you can imagine. So it still has it's dimmable, it's 3000, 4000 Kelvin, even higher. The best CRI above 80 or above 19 aspect. But if it's if we use this solution for MRI, we use a special set of luminaires, as I explained earlier. So on top of that, there is also controls. Maybe Elina, can you tell something about this part?
Thanks, Bart. So, like mentioned before, we can control not only the lighting with smart lighting infrastructure, we can actually control the whole environment. So, if we would need to adjust, let's say, temperature, humidity, even manage crowds, like I think somebody was mentioning that the hallway situation is important, the concentration of people next to the scanner room. We can actually use a simple sensor in our luminaire, and we can evaluate the environmental parameters based on the data. We can also integrate with existing HVAC and BMS systems to actually leverage this data to provide optimal environment for the patient and the staff.
Okay, thank you. So we move to the next concept. So this is the soothing ambience. So we already mentioned that patients need to feel comfortable before the scan, as it's important that they lie still during the scan. So how can we support that? Well, first of all, we can use programmable white and colored lighting. Then we can use for ambient creation. We can also add colored lighting to it. And if we want, we can also add imagery to it, like this. And here you see an example with our large luminous panels. It's a color kinetics product. This can only be used for CT and PET scan because it can't be used in the MRI because it's not EMI proof. But there are other solutions for that, like a projection of a TV screen with non-ferrous materials, which I show in the examples on the next slide. Well, then we have personalization. Yeah, because we have these simple controls, we can also have a patient select their own ambience, so they really have something that they feel comfortable with. We can put that on a controller, maybe on an iPad, and then they can choose it themselves, a tablet. Yeah, so that's the intuitive controls. So here you see two examples of this concept. So Philips calls this ambient experience. And they, yeah, like you see, they use a projector for this, but probably it doesn't have ferrous materials in there. And they did a survey in 2020, and they revealed 90% reduction in sedation, 70% reduction in rescans, and 83% reduction of reported patient anxiety. The other example is from PDC, and they call their concepts caring MR suites. And they also found a significant drop in the use of anesthesia and also in reducing patient anxiety. So these things really make a difference. So Bart, can you tell us a bit more about possible executions of this?
Yes, thanks, Ramon. So here you see not only the operator room and the image room, you see also the waiting area and the changing room, or the room that is used for giving the contrast. What's called contrast fluid. Now, on top of the general lighting, we place a cove lighting in this to add some color and to add some effect to the room. As Ramon already explained, it's also possible with large luminous surfaces in some of the imaging rooms, not all. If you go one slide further, you see that the products that we are using for this is not only the large luminous textile for the color effect, but we can also use a cove lighting for this. It's also from Color Kinetics. It's the Pure Style Compact. And the beauty of this product is that you can provide color, you can provide it dynamically, you can also provide white light with a high CRI above 90, and that's quite unique for cove lighting, and this is what you need in the imaging room.
But
it's
am I right?
already suitable for MRI,
Yeah.
so you can use it for MRI. And next to that, you see some solutions for the white light or tunable white light.
Okay, yeah, that was my question. Is the Pure Style right for MRI? But you answered that. Thanks,
Yeah.
Bart.
Yeah, it's right for MRI. You can use it because there's EMI proof and no ferrous materials inside. Yeah.
Thanks, Bart. Then the next slide, I will give the mic to Jelle again.
Okay, so you see again this picture, but now a different lighting, now with Nature Connect, which is really designed for giving that outdoor feeling indoors. Yeah, maybe just to highlight a little bit what does it do and how to imagine how it feels. I think for most people it's getting maybe end of the day. You will probably see a bit of a reduction of your alertness, and maybe you might lose a little bit of concentration, which is normal, right? If you walk outside, then you will have the daylight, right? And you get that energy boost again. You get more energy, and also if you are more outside, you will sleep much better during the night. But that's the feeling which we also give here to this control room of the MRI. And obviously we also implemented this. I'll show you the use case later. So how could we implement this in this same application again? We have those two mini islands, 120 by 120 centimeters in the control room. The lighting is very uniform, so it's very comfortable to work under. It meets the UGR 19, so it's really office compliant, and also has can have high light levels to really give you that daylight feeling. In the bottom, you see areas like the dressing area or the corridors. That was one of the comments of somebody, not to forget those areas. Here we have put in smaller skylights. Again, office compliant, so we manage the glare. And this is a 60/60 skylight, which can really go into the grid or in a plastered ceiling. So that's also really easy to build in. And they're all tunable, but can also have the day rhythm, so that at the end of the day, basically, the lighting becomes warmer, the skylight becomes less intense, really to give that signal to people that it's end of the day. In the MRI room, we will stick to the normal lighting. With, in this particular case, we propose the downlights with the cove lighting on the side. So let me show you here an image and a real case study which we did with Nature Connect in the control room of a CT scanner. This is in the Netherlands, in the Catharina Hospital. Here we also did research. So we compared what are the work circumstances in this room compared to the control room next door. People filled in questionnaires in the morning and in the evening in both situations. So they worked in both rooms and they filled in the questionnaires several times to get more data. The conclusion we can take out of this is that people miss the daylight less. And they say that Nature Connect is actually a nice substitute for daylight if there's no real daylight. So we take it as a compliment because we know the challenges in healthcare are quite big, because you will always have these kind of areas without daylight, and then Nature Connect is a good substitute if there's anything who can do this. So people miss the daylight less, but also say, hey, it makes it a much better place to work. Again, via this QR code, if you would scan it, you would go directly to the study. But I've also put the webpage of Nature Connect in the chat, so you can find much more information and even more studies online. So if you look into the products, on the left side you see different form factors of Nature Connect. The one on the top left is what you saw in the case study which I showed. So it's 120 by 120 centimeters. You can give this high melanopic levels in order to give this energy boost to people, but at the same time the light is really nice white, so you're not sitting under something blue, which is maybe less comfortable. And below you see this 60 by 60, which can either be recessed or suspended. On the right side, you see all kind of solutions for the walls. On the top, you see the pure style, which has been presented earlier already, and which can go into the MRI. The lightscape is particularly meant for giving a light landscape concept to the wall. And on the left side, for example, you see what is the scene during the day, and on the right side, it's much more if the sun is going down, it's end of the day. That really, those colors really help to give a moment of the day, to give that feeling of moments of the day, which is often lacking if you have areas without any daylight. So yeah, there are different ways of how to control our lighting and Nature Connect in particular. I won't go into all the details, but we have basically all our lighting recipes already pre-programmed in our scene set. And that can be then connected to a wired or a wireless solution, really depending on the need of the customer. So I won't go into all the details, but there are multiple options possible there. Now I will go into a video, and that's a case study of where Nature Connect is implemented in an eye clinic in the Netherlands. And it's where the staff is talking about what is their experience. So have a look.
As a project leader, I was involved in the design process of our new eye clinic. A challenge was the fact that we wanted daylight, but since we have no actual windows, that was a problem. And that's why we chose Nature Connect from Signify. Its natural daylight relaxes our patients during their stay, during their treatment. And both our patients and our staff are very positive about the natural daylight they experience.
When I'm at work, sometimes I think the sun is shining and it feels like I'm working on the daylight. How energetic that is. Nature Connect gives me a lot of energy during the day. Also, the patients are convinced they're looking outside and they see the sky. Nature Connect is really stunning, relaxes, and it gives us energy.
So that was Nature Connect. Now Bart will explain a bit more about the norms we see in imaging suites.
Yes, thank you, Ramon. Those are the two norms, or actually it's one norm for imaging seats. Basically, the general lighting should be around 300 at minimal and 500 as max, according to the European norm. Uniformity should be 0.6, so that's quite high, and the color rendering more than 80. Now, we see from requirements from hospitals that those norms can be exceeded. So I saw last week one for 1000 lux, so that's 2 times as high. And then you can ask yourself, are you going to use the general lighting in the complete area? Because sometimes those imaging rooms are quite big. Or shall I apply it only on the patient area? especially when you use cove lighting, because if you use cove lighting, you don't need 1000 lux everywhere. So if you want to step away from the norms, it's always good to do that in advise or consult the client and speak out loud how you want to design the room. Another thing is that you can dim the light very good. That is especially done or if you use a monitor in the same room to reduce the contrast between the walls and the screen. So then you dim to 50 lux in the space or even lower. Now that's suitable for all the luminaires that we just suggested, because you can dim to 1% of the light level.
Okay, so this brings us to the end of our presentation. So